Hi, this is Dr. John Ziegler with Trinity Integrated Health and Wellness Center, and today we're going to be talking about phases of degeneration of the spine. Now, there are three phases of degeneration in the spine, and when we take x-rays, we're looking at which phase you're in because that's going to determine how much care you're going to need and what your prognosis is going to be. And so when you come in and we do these x-rays, we will go over them with you and show you which phase. But let's get into what the different phases of degeneration there are. Now, this is just a normal vertebra. It has normal good disc height. A disc is kind of like if I took an onion and I cut it crossways, I pop the center out and I put some jelly in the middle. So it's got a jelly center with rings surrounding it. These things are about 93% water, so they're really easy to dehydrate. So when you hear the term degenerative disc disease, think about these discs shrinking up or dehydrating. And that's why oftentimes when you get older, you'll lose a little bit of height as you age. Now, when we look at a normal one, we have a nice thick disc. If we look at it from the back, these are where your spinous processes are, and each bone moves on itself. Well, with these discs, they open up the holes where these nerves come out. So there's two reasons to have a disc. Number one is to be a spacer. It keeps the bones separated so the nerves don't become pinched, because if they become pinched, you're going to have symptoms such as numbness and tingling, sharp shooting pains down the arms or legs. Second thing is they act like an individual shock absorber. So when you're walking, running, or carrying anything, your spine's kind of bouncing up and down, and it's acting as a shock absorber. So when we're looking at phases of degeneration, when we look at phase one, if we look at this, you'll see that there's a slight decrease in degeneration from this to this. If we look at it from the side, you see that this one's the same thickness throughout. However, this one's kind of wearing down in the back side. You can kind of relate this to kind of like if I'm driving my vehicle and my wheels are misaligned. If I don't get my wheels aligned, over time, it's going to put an abnormal wear pattern on my tires and wear my tires out earlier. Same thing happens in your disc. So when we're looking at this, at the x-rays, if we see a decrease where the bones are kind of dropping down, such as this, and it's starting to wear across this back side, we know we're in phase one degeneration. However, we don't see any arthritis or anything like that at this time. Also, sometimes in phase one, you can have a little tear in the rings. So again, it's kind of like if I took an onion and I cut it crossways, pop the center out, and put some jelly in the middle. But what if my little rings tear? Now, in the disc, there's not a lot of nerve supply there. I could take a needle and stick it straight down the center of this disc and you'd never feel it. But if I took a needle from the side, there's nerves in the outer three rings of this disc. So anytime you have a little tear in those rings, it's going to give you some back pain or neck pain. And oftentimes that's what brings people in to see us. The only way you're going to truly know this is if you get an MRI, but oftentimes with an x-ray, you can see that degenerative wear on the backside of the disc. And then when you look at it with symptoms such as bending over or twisting, and then all of a sudden my back hurts really bad with a sharp pain, we know a lot of times that's these tears. So in phase one, we don't see any arthritis. Everything is moving well, just like what we see in a normal one. However, we are seeing a little bit of degeneration in this disc. And so our job is to stop that degeneration and get it back to a healthy state where you can function at your optimal. Now, if you disregard this and you don't come in for care, a lot of times over time, things will wear down more. Nothing's ever staying the same. It's either getting better or worse. So a lot of times you can go into what's called phase two degeneration. Now, here's where it gets a little more serious. So not only are you seeing a decrease in the disc from here to here, but you also see these little jagged portions right through here, which are bone spurs or osteoarthritis, and I'll explain them in a second. Also, when we look at it from the side, this disc is still open enough to where the nerves are coming out, have plenty of room. However, when we go to phase two degeneration, now it's kind of closing down, and also our nerves are not quite as thick or healthy as in phase one. So when we get to phase two, we're losing more disc height, we're having more degenerative disc, more dehydration, and our nerves are starting to cause to shrink. If we look at it from the back, where in phase one, we have a nice smooth surface on the back where these bones hook together and everything can move real well. In phase two, we see a lot more arthritis on the back of the spine where the bones hook together, and this causes a restriction of movement. So this person may, let's say it's in the neck, this person may be able to turn around and look like this when they're looking back at a car. However, this person doesn't have that range of motion, so they're having to turn their whole body. They can't just turn their neck because now all of a sudden they have these bone spurs and arthritis. Now, the bone spurs and arthritis are real simple. Think of it this way. If I get my vehicle stuck and I need you to pull me out, we're going to hook a chain to my vehicle and your vehicle, and we're going to start pulling on it. When we put tension on that chain, if that chain's going to break, it's going to break at its weakest link, right? Well, think of it this way. I don't know if you've ever sprained an ankle before, but just like you can sprain your ankle, you can sprain your back, your neck, or any joint where you have two bones at. Well, every joint has muscles, tendons, and ligaments that kind of surround the joint and stabilize it. So when you sprain an ankle, you're spraining ligaments. So a ligament, just think of it as a piece of cloth that's sewn right here between these two bones. And it runs the whole spine, but let's just, for this purpose, let's think of it this way. So what happens is when we sprain a joint, you stretch or tear that ligament. Anytime that ligament gets stretched or torn, everything gets loose. That's why it's easier to sprain your ankle a second or third time after you've sprained it the first time. So what happens is the body loves stability. It wants everything in normal ranges. It wants your blood pressures in normal range, your blood sugars in a normal range. It wants your joints moving in a normal range. So anytime this thing becomes hypermobile because you sprained it, like whiplash from car wrecks or lifting on something, over time the body says, hey, if you're not going to stabilize it, I'll stabilize it for you. And the way I'm going to do it, I'm just going to throw some extra calcium down on that ligament and I'm going to tack weld it for you. So anytime you hear the term bone spurs or arthritis, think about the body trying to tack weld two bones together. The problem is, yes, it stabilizes, but it decreases movement. And anytime you decrease movement, you increase pain. That's why exercise and chiropractic are very good for you, because we reestablish movement into those joints and allow the pain to decrease and you to be more functional. It's also why a lot of times when you sleep at night and you wake up and the next morning you're so stiff and achy, once you get moving, you feel better. That's this right here. That's these degenerative discs, but bone spurs or osteoarthritis and a decrease in movement. So our job is to get that back moving. Now, let's say you still don't come in and you have these bone spurs. Well, again, things are never staying the same. They're either getting better or getting worse. Over time, it will go to phase 3 degeneration, which is the final phase. At phase 3, if you look at the disc is totally dehydrated and it's like an old cavity in a tooth. It's totally gone. It's basically bone on bone. The arthritis is totally around. It's just like I welded these two bones shut. They no longer move individually. Now they move as one. If you look at it from the back side compared to phase 2, well, we at least had a little space for movement in phase 2 and still had some movement. Now in phase 3, there's none. It is totally fused. It's no different if you went to a neurosurgeon and they fused these joints together. Also, if we look at the nerves, now they're really decreasing in size, and the hole where the nerves comes out are just basically gone. So there's not a lot of space there. There's a lot of compression there. Most of the time, people will see a muscle wasting or numbness or tingling or sharp shooting pains going under arms. This is the final phase of degeneration, and it's much more difficult to get any kind of healing in this process. And also, because this is locked down, now the next segment above it has to move extra. Because remember, this is kind of like your spine is kind of like a chain with links. And so this has to move extra. And anytime this is having to move extra, now the next section will start breaking down. So it's very important to come in and get your spine checked. And just like I tell people all the time, you go to the dentist every year to get your teeth checked, it cleaned and checked for cavities. You go take your car in to get it, the wheels rotated and to get oil changed. You go to your medical doctor for health benefits to get checked with your blood work. Well, just like you do all of those, you should do the same thing for your spine. The difference between chiropractors and dentists is you get to see your teeth every day in the mirror, but you don't get to see your spine. So you don't really know what's happening in your spine until you get an x-ray. So I highly recommend that you come in and see us. Let us x-ray and let us check and see which phase of, if any, that you're in. Hopefully you're not in any phase of degeneration. We can stop you from even starting to head that way. But if you'll come in, let's just see what kind of phase of degeneration you're in. See if we can help you. If we can, we will. If we can't, and it's something that needs to be referred out, we'll be happy to do that. But either way, it's good to know so that you know how to work for the rest of your life and how to function for the rest of your life. You don't end up in an older age where you can't enjoy life and you have no function. So please come see us. We'd love to take a look at you. And if you have any questions, please call our office at 352-0099. Thank you. Have a great day.